evidence-based. I'm going to say something that's going to sound the most disrespectful toward our scientists in the world. And I don't mean to be disrespectful, but I mean to challenge you to think a little bit about this because it's so important. You know, today we live in a world of what's called evidence-based. If the evidence, the research studies haven't shown it, then it can't be right. Doctor, let's say this. Evidence-based is not just what the research people have discovered. It's what you have discovered in your very own practice setting. It's very important that you develop your own evidence base because, number one, you find out what works for you and what seems to be doing the best for your patients. And you constantly learn, you constantly grow, you constantly try new things and work to get better. And so your evidence base becomes very important. All right? Now, there's a guy named Dr. John Ioannidis, who's a scientist, absolute fantastic researcher, MD, PhD. He has degrees more than a thermometer, probably. And he showed back in, I want to say like the 80s or 90s, he started and now has published hundreds of articles about how research itself is very, very flawed. Why is it flawed? Because the researchers who do the research are affected by their findings, their beliefs, and what they want to find out. Sometimes they're even affected by who funded the study, because unfortunately we're human and that bias can jump in there too. But that's not my point today. My point today is that if 70% of research is flawed, our evidence base could be as much as 70 or more percent flawed. But your evidence base has to come in and work for you. You have to find out what your evidence is and what you find to be the very best in your hands for your patients. Don't feel like you're cheating. Don't feel like you're not following science. You know something? In medicine, let's digress for a moment. It has been said in a research study, if we believe it, I don't know, that there are enough medical errors in this country every month, medical errors, that result in the death of the patient, medical errors that result in the death of the patient to fill 2 747 planes to capacity, which we don't have a lot of 747s in the air anymore, but I think they held 500 to 600 people at the most. Every month, medical error that results in patient deaths. And a lot of those errors, honestly, you have to read the studies, are said to be, again, we're not sure what to believe, but we've got to look at it, are said to be based on pharmaceuticals that are flawed, based on studies that are flawed, based on procedures whose research is flawed. Please understand, we can only do the best we can do. Don't discount your evidence-based doctor because it's very, very important to your doing the very best that you can do. Some thoughts for today. Dr. Chris, signing off.